Dr. Nilanjan Thakur, prevention and management of iris prolapse. Very important topic. Dr. Nilanjan, are you ready?
Yes, I'm there.
Please share your screen. Yeah, please share your screen. Yeah, it is in.
Good evening, everyone. I am Dr. Nilanjan Thakur from Assam, Silchar Medical College. So I'll be speaking on prevention and management of iris prolapse. Now, how many times have you been confronted by an iris that either prolapses or threatens to prolapse during cataract surgery? As any surgeon will tell you, once is too often. Now, are there reliable strategies you can use to stop it from recurring? The answer is yes, but not always. Now, you should plan your game wisely. Most surgeons group risk factors of iris prolapse into two categories: pre-existing and intraoperative. Pre-existing, a proper history of alpha blocker is very important. Pay special attention to wound architecture. Pupil size management is very important. Now, you should give preoperative topical NSAIDs to maintain the intraoperative mydriasis. Now, it is all about pressure. Safeguarding the iris is also about controlling the pressure. Now, these are some of the tips. Create a good and perfect wound. Avoid retrobulbar hemorrhage during block. Avoid overfilling the antechamber with viscoelastic. Remove the viscoelastic before hydrodissection. Support the iris mechanically with iris hooks or rings if there is floppy iris syndrome. Now, how do you respond to a prolapse? Here I want to present some case scenarios. You can see there is prolapse of the iris from the side port. Don't push the iris. Just decompress the eye and just massage over the upper lip of the incision. So the iris will fall back. So this is another case scenario where you can see there is prolapse of the iris from the side port. In spite of decompression and massaging, the iris does not fall back. At this moment, you can use a blunt cannula or an iris repositor and slowly make it fall, sweep it over the iris, that the iris falls back. But be very careful that you don't traumatize the iris. So this is another case. You can see the wound architecture was not good over here. And once we did hydrodissection, there was iris prolapse. Now you should remember over here that the iris has a memory which will always go on prolapsing. So you should stop your urge to prolapse it, repose it always, because there will be pigment loss and that will cause post-operative inflammation, transillumination defects, pupillary defects. So this is another case scenario. This should be avoided at any cost because that will cause iododialysis and holes. So you can take a cannula or an iris repositor and sweep the iris from the opposite side port. But you should be very careful that you don't traumatize the iris. So this is another case scenario where you can see the wound was not proper and there was prolapse of the iris. So don't push it back always. Try to work over it. And I am dialing the nucleus out of the capsular bag into the anterior chamber. Now, once you have done that, you can push some viscoelastic so that the iris falls back and you can take out the nucleus. But while giving the lens also, you should be very careful because the haptic might cause injury to the iris and cause iododialysis. And later on, it's always preferable to give a suture. So the ideal thing is that you cannot avoid iris prolapse in a surgery, but a small iris prolapse, if you don't manage it nicely, can give you a real headache. Thank you so much.